It's loaded and we're live. So, hello, healthcare, hello, LinkedIn, and hello, YouTube. We are excited to have this conversation because it answers it answers something that I think a lot of people that I've talked to over the years, a lot of people who might be on this call, are extremely focused on how to deliver a better consumer and patient experience in healthcare. And here comes all these other companies that kind of see the gaps in where healthcare is and delivery of what consumers expect from their experiences, and they're saying, okay, well, there are these gaps. What can we do to work with and establish relationships in that vein? And to that end, there was a recent recent documentary that came out on CNBC called How Walmart Plans to Take Over Healthcare. That's where our title came from. It's not clickbait. We're going to get into it. But James Gardner has been doing research extensively in this field. You might have heard him on Chris Boyer's podcast or seen pieces that he's pushing out on healthcare's disruptors. So, James, really happy to have you. Anything you want to say before we go ahead and get started?
Well, hello, Chris. Hello, Audrey. I'm excited to be here with you and your posse of fellow healthcare devotees. It's going to be a fast 30 minutes as we look how Walmart and others are disrupting or are poised to disrupt primary care traditionally delivered. So let's get into it.
Sure thing. And I also wanted to introduce Audrey Wyman, who's our co-host. She works along with me at Symphony RM. I focus on data science projects, and she focuses on client and consumer experience and has a deep background in both. So Audrey, anything you want to say before we go ahead and get into it?
Yep, that's great. Delighted to be here.
All right, fantastic. So folks, for anybody who is new here, the way that we do this, the reason that we brought James today is when you're watching it on CNBC, you probably had all kinds of questions, all kinds of stuff that you wanted to discuss with him, thoughts to share and stories. Granted, they put a very high quality piece together, but you didn't get that back and forth. So here we're inviting you to have the back and forth. We have experts every week. And if you have questions, if you have stories, it's a community here. Share your stories, share your questions, share your thoughts. And we like to highlight that and get into it. We were talking a little bit earlier that it's been really lonely not being able to hang out and have conferences in person or lunch meetings and things like that. So that our secret reason by putting these things out is because it's as close as we can get to it. So feel free to share your questions and comments. And just to get started, James, just with the basics. Why is Walmart interested in healthcare, and what is Walmart Health doing to attract patients?
Great question, and a super logical starting point. I guess I would start with just the observation that Walmart's not new to healthcare, right? They've been operating pharmacies for 15 plus years and are a huge player in that world. They're also very strong in vision, audiology, and obviously direct-to-consumer consumables. So they sized their existing health and wellness business at north of $40 billion. So they're already a major player. But I think what you're getting at is the hands-on delivery of care, which is what we're seeing piloted in Georgia, and which is causing much discussion. And that's the focus of the CNBC article and the focus of my passion. As Walmart describes it, they got into healthcare because their customers led them into it. There's a huge problem, as we all know, and it's perhaps even more acute within Walmart's population base of people on the outside of the healthcare system and not getting access to care. And in many cases, it's simply a logistical issue that in many parts of the country, there are no primary care physicians, let alone mental health professionals, vision care specialists, et cetera. So there's just an impossibility of getting access. But Walmart also heard from its customers that they couldn't afford to get into the system. Many are uninsured, which is a phenomenon that continues to curse our country. But many are what I call underinsured, where technically they have insurance, but with copays and deductibles, it essentially makes access to the system cost prohibitive except for catastrophic situations. So Walmart's customers were experiencing this access problem, And like any good retailer, Walmart's pretty dialed into problems amongst their population base. You know, they know more about you than you'd like to imagine. So that led them to explore healthcare. And of course, I'm sure along the way, they checked all the obvious boxes, right? That their investors and their MBA types would be looking for. Is it large? Yes. Healthcare is colossal, but even primary care and dentistry and some of the other fields that we'll be talking about, very sizable. Is it fragmented? Yes. Are there customer experience opportunities for improvement? Definitely. As we all know, the system's far from perfect in delivering world-class experiences. And were there opportunities for operational improvements that perhaps could streamline the experience and take costs out? Walmart checked all of those boxes. So it was in the fall of 2019 that we saw the first clinic open in Dallas, Georgia. And let me describe it for people that aren't familiar with these clinics, because they're ambitious, they're exciting, and they're different than anything we've seen. We're all familiar with minute clinics, perhaps at CVS, but what Walmart built was a standalone clinic adjacent to one of its 3,600 supercenters, which are the grocery plus food shopping centers that I'm sure we've all seen. It was sized at about 7,000 to 10,000 square feet. They've flexed over the course of the pilot. And within that one standalone clinic, not only were they delivering primary care, but also dentistry, vision, audiology, mental health, as well as x-rays, labs, and then the adjacent pharmacy. So very, very ambitious. Staffed also, of note, with primary care doctors, alongside nurse practitioners, physicians' assistants. But the presence of a doctor on site obviously signals to the world that they're delivering more complex care. And they're also interested not so much in episodic care, like an urgent clinic or walk-in, but they're interested in longitudinal care, where over the course of weeks, months, years, they want to be your doctor. They want to be your dentist who keeps you well and prevents you from getting ill, and then takes care of you if circumstances demand it. Very ambitious. The capstone or the icing on all of this was the pricing model, which I think people still find shocking. An example being mental health counseling for stress, depression, addiction. It's $1 a minute with a licensed trained professional. That's 30 to 50% less than what you're going to see in traditional primary care clinics. So very
and that's
ambitious.
regardless of insurance.
Well, that's interesting too. They do accept commercial insurance, but they're much more focused on the cash pay audience, which makes sense. They're appealing to people that are on the outside of the system and may not have insurance, may not want to use it because of the copays and deductibles. So they're drawn to this cash pay model, which we can get into when we talk about the physician experience, because I haven't met a doctor who loves dealing with insurance companies, and the ability to operate on a cash pay business is also quite intriguing.
Those are
So what's,
go ahead, Audrey.
I was just going to say, what's different this time around? So they've already forayed into this. What's different now?
Right. So students of health clinics may recall the Walmart Care Centers, which were, in my mind, essentially a clone of the urgent care centers that you see at CVS. They were staffed with a nurse practitioner, so they were limited in the scope of care that they could provide. They were also operating strictly within the footprint of their retail stores, so they didn't have a standalone clinic, and hence they didn't have the space to offer all the adjacent services like dentistry, vision, mental health, and whatnot. So it was a much less ambitious vision, and one that they've kind of walked away from. They're much more focused on the clinics at this point.
So we got, I want to give a shout out to Shantae really quick, because we had a plan to discuss the specialized care experience, but she said, let's get to it. Like we know they're here. How do we look like knowing that they're going to be a presence in the market? What's the structure that they're looking to partner with health systems? How do we structure for things outside of that baseline of services that they offer? And then some additional questions on, hey, do they offer labs and things like that? But ultimately, what does that partnership look like with existing care?
Yeah, terrific question, Shantae, and one that health systems across the country are pondering. So imagine yourself a typical health system, maybe one in the Georgia area, where Walmart's built out about 15 plus clinics surrounding Atlanta. Walmart, it could be said, is both a friend and a foe, and or a competitor and a collaborator. Because on the one hand, these large health systems have employed physicians, many of whom offer primary care. So they're somewhat in the crossfire. But at the same time, there's a nuance there, because a lot of the Walmart customers are new to the system. They lack insurance, or they have poor insurance, so they're not seeing traditional doctors. So in that situation, it would depend on your patient population. You may see some attrition to Walmart from your population base, or you may see very little. It would depend on the makeup of your patient population. The other group of employed physicians are the specialists, which I think is the focus of your question. And there, I think there's actually an exciting opportunity for collaboration, because Walmart's not a hospital. They don't employ oncologists or people in the orthopedic field or oncology field. There's a huge gap there. These are strictly primary care physicians. So it's an open question right now as to what Walmart's referral strategy will look like. Clearly, it's not going to be haphazard. It's not going to be at the physician's discretion. I would imagine there will be relationships and partnerships struck. Let me just put a little exclamation mark on that, because I've also heard speculation that Walmart may take an approach similar to how they treat their employees. So if you work for Walmart, and you're one of 1.5 million of them, Walmart is very intentional with your access to care. If you need a hip replacement, for instance, they're very, very data-driven around both outcomes, because they want you to get the best possible outcome for their dollar, but they're also very conscious and are data-driven around the cost, because we know that costs for different procedures vary widely, even within a small community. So let's just imagine what that would look like if Walmart applied that model to its patient referrals and was very intentional about steering patients where they're going to get the best outcomes for their dollar. Why would they do that? It's a huge customer win, of course, but those savings inevitably, people say, are going to make their way back into Walmart's cash register. So you can do well by doing good in a situation like this. So it's fun to speculate where that might take us.
So, James, first of all, I want to comment that you're doing extremely well with these responses, because the comments are flying at a rate I haven't seen on the on this series. So thank you.
I've got a lot of friends and family.
Hi, Mom. One question, and Audrey, I'm going to steal this question from you because I'm seeing it come up. Alan Shoebridge. This is another example of something that we wanted to discuss a little bit later, was that provider experience and provider relationship. So Alan is referencing the current provider shortage in the country and Walmart's ability to scale and grow and provide an experience to attract and retain physicians. Curious your thoughts on that.
Yep, it's a great question. Thanks, Alan, and hi, good to see you on the webcast. Recruiting is never easy, right, for clinicians, and Walmart has made it perhaps more difficult for itself, or perhaps more easy for itself. At least with the pilot locations in rural Georgia, there's not an abundance of primary care physicians in those markets to begin with. So a little bit of a challenge, a bit of a headwind, I'm sure, along with dentists and mental health specialists. So they had their hands full, I'm sure, through 2020. That being said, I'm told that there are physicians who actually enjoy rural life. They're not necessarily drawn to the high cost of living or the stress and anxiety of New York or Boston or San Francisco. So there is a population of physicians that are quite comfortable with that and enjoy life in Walmart country. There's also the reality that many primary care physicians, they want to deliver care. They're not interested in setting up a practice and becoming entrepreneurs and having all the stress and anxiety of filling their schedule and building their practice. There is something appealing, I would imagine, to a 9-to-5 job as an employed physician with all the lifestyle advantages that would accrue. So it's a double-edged sword. I know they have a very active recruiting team, and they seem to be staying on top of it as best they can.
So,
James, that's a great point about the provider's experience. I had an experience, I was an early adopter of these retail clinics. And one of the things I noticed is I had great long conversations with, this was a nurse practitioner. And I asked her one of the things she loved about working in this retail setting. And she said, I have tremendous autonomy that I haven't had in years.
It's good to hear that. For what it's worth, I'm also told that in the world of pharmacy, where Walmart has a long history, they're actually considered a very desirable employer. They're treated with a lot of respect in the store, a lot of autonomy, as the professionals that they truly are. So there is a model there that suggests Walmart may have success hiring and retaining these very elite professionals.
now, so we talked about the provider experience and retaining and recruiting providers. And at the very beginning, we had a discussion about the gaps that Walmart saw in the consumer experience being provided. We got a question from Jane Weber Brubaker with regards to, hey, what's the early response here? How have consumers responded? There's some research that we plan to do on this subject using natural language processing on some of the reviews that are coming out. But I'm curious, just early on response, what's been the consumer response, or is there a place that people can go to kind of check up on that?
Hi, Jane. Thanks for the question. Another old friend of mine, and happy to see you joining us today. All we know about consumer response is what Walmart has told us. So let's take it with a grain of salt. They're painting a picture of consumer satisfaction. They're painting a picture of repeat visits and an overall positive experience. So that's one data point. I think we also have to just realize that Walmart obviously is polarizing because of the success they've had in retailing and the swath of challenges that they've created in that world of retailing. So there are Walmart detractors. We know they're out there. There's entire parts of the country that don't have Walmarts. But at the same time, there's a huge part of America where Walmart is part of the community, is a huge employer, is the go-to shopping destination for dry goods, but also grocery. And there's actually a lot of brand affinity that perhaps we don't see in Boston or San Francisco or other major metro areas where they don't have that same presence. But in a lot of America, Walmart is seen as a force for good, especially as they offer healthcare that's newly accessible and affordable. So I'm mindful of that as I think about the consumer response.
And another question, so leading on to that too, just with the price advantages that they've created, John Marzano, hey John, also had a question that was just basically around, hey, what are they doing to control their cost basis? How can they do this in a way that's cost efficient while scaling up nationally?
Yeah, hi John, good to see you. Welcome today, another friend. So yes, can Walmart deliver healthcare with these prices and this model profitably? So starting point to that answer is Walmart insists these clinics are profitable and will remain profitable if and when they're scaled. So there's no sense of them being altruistic and offering these clinics somehow at a loss. At the same time, we all have to scratch our chin and ask, how is that possible with the pricing that we're seeing? Now, let's parse that a little bit. We know in the world of retailing that Walmart's notorious for squeezing their vendors. So I imagine with the actual build out of the clinic, for instance, it was probably no fun to be their furnishings vendor or their construction vendor. I'm sure Walmart struck incredible deals. But that's a fraction of their overall cost structure, right? If you look at what it costs to run a clinic, it's the people. And you can't squeeze labor costs, especially with clinical professionals. It's a market. And if they feel poorly paid or poorly treated, they'll walk. So there are no economies there. So that begs the question, how are they making money? If a mental health professional is charging $1 an hour, we can do the math that there's 50 weeks in a year, there's 40 hours a week, there's 60 minutes in an hour. They've only got like $120,000 worth of inventory if they were at 100% utilization. So the numbers are challenging. even for Walmart, who lives in the world of pennies on the dollar. But what we've all uncovered as we've spent more time looking at the model is Walmart's thinking much more holistically about what it means to be profitable. And what they're finding, I'm told, is that the clinics are actually a powerful, powerful way of getting people off the couch, away from their computers where they're shopping on other players in the space, and getting them physically into the store. So it's activating lapsed shoppers who've gone digital. And it's also, I'm told, increasing the frequency of store visits, and at the margin, increasing typical basket sizes. So combined with that holistic model, they're painting a picture of these centers being economically viable. I hope that's helpful.
Extremely, extremely helpful. And there was a question that came in a little bit earlier, but it kind of fit into some of the discussion points that we're making now, especially when you refer to that longitudinal care. So this one, I'm searching for it. It came in from Brian, which was, how do you expect Walmart to use data to evaluate the wallet share of a customer? I kind of wanted to expand on that. So just, I know that Walmart is, of course, responsible and tight-lipped about their practices with data, but just some insight on, even if you read the description of this, we said that transactional is the opposite of relationship. So we're curious about how Walmart might use this data to focus on, expand, and grow those relationships with patients.
So I don't think we know, but I think we can draw some logical conclusions from what we're seeing. One is that it's obvious Walmart itself as a retailer is sitting on and generating colossal, unbelievable amounts of data every day. They're a $500 billion retailer. They've got foot traffic in their stores every day, every week. That's unimaginable. They're capturing everything that goes on within those transactions. Layered on top of that, a loyalty program that allows you to associate data with individual families and consumers. And then more recently, they have a competitor to Amazon Prime, Walmart Plus, which is another source of data. So in terms of access to information, few know more in terms of your habits and your practices. Similarly, in the clinics, they're generating patient data. I've not heard anything, and we should be clear about that. I've not heard anything that suggests they're somehow fusing the two. I think that would be problematic for a lot of people. If your medical information was somehow powering promotional offerings or the like, I think that would be very, very uncomfortable for a lot of people, and perhaps even illegal. So there's been no talk of them doing that. And I think it would be a third rail if they tried it and consumers reacted as I imagine they would. I will draw people's attention though to an interesting pilot which has gotten some buzz in the last week or two. It's being run out of Walmart's incubator in New York, Store 8 as they call it. And they're hiring data scientists and others familiar with the world of big data to, from what we can discern, create an app that uses big data and machine learning to drive extremely personalized, healthy shopping information that will, we imagine, help people with diabetes, heart problems, and whatnot be more intelligent shoppers and purchasing things that are going to benefit their health. So that's out there, and I think that's a really interesting example of Walmart taking the lead and using data at their fingertips, in this case for something that's pretty exciting and will help people.
So when one way that we know that they'll definitely use data and are already using data is just identifying where to build centers, where to expand, where to grow the platform.
Absolutely.
Hello, everybody from Atlanta, Georgia. I am beaming in from the ground zero state where Walmart Health started in Dallas, Georgia. But Shantae had a question about their expansion across the nation. Do you have an idea on when we can see that westward expansion, or what's going to be what kind of markets they're prioritizing for their growth?
Right. So thank you for the question, Shantae. So you're exactly right. Clinic number 1 was in Dallas, Georgia, which is adjacent to Atlanta, but on the outer suburbs, I would say. They've subsequently built 15 or so encircling Atlanta. So that's where the greatest concentration of effort has been. In parallel, they added 2 clinics in Chicago as part of rebuilding of supercenters after the civil unrest of the summer. Walmart made a commitment to the community both to rebuild the centers, but also add sorely needed Walmart health clinics. So those are in a more urban setting, which is quite interesting. I'm sure there's interesting learnings coming from that. And then there's also a clinic adjacent to the headquarters in Arkansas, which we can imagine is a showcase for the leadership of Walmart. Where are they going next? Here's what we know. There are open plans to grow in Florida in 2021. They'll be in Jacksonville, Orlando, and those markets. Probably 15 clinics, maybe 20 clinics. That's what we know. There's speculation as to where they may go next, but that at this point is all that we can pin them to.
Very interesting. I keep drawing in to all these points that you're making, and it echoes within the audience as well. And I got another one from John Marzano that I thought was interesting, because in our talks earlier, we were talking about this clash of the titans. Because folks, like Walmart's not the only one out there doing this. Obviously, there's other models. There's other, like One Medical has their own view of how they establish referral relationships after owning that primary care experience. So yes. With this mix of different models, different approaches, what is your thoughts on the words that you use, the clash of the titans? What are your thoughts on where what the impact is going to be to existing healthcare practices?
So let's briefly look at the landscape of retail health and the major players, because you're right, they're all exploring different models. We've talked about Walmart's approach, where they're taking advantage of real estate, which is their competitive advantage. 3,600 supercenters with parking lots awaiting clinics, as people joke. So clearly they're going to build off that asset. Walgreens, another huge player in this world, is going down a different path. They've partnered with VillageMD in an exciting but less ambitious model of deploying primary care clinics within existing Walgreens locations. So there'll be no dentistry, there'll be no mental health and whatnot, and the pricing won't be as ambitious as what Walmart's doing. But nonetheless, you don't overlook Walgreens. They're a sizable player. CVS, I think, has a much more exciting vision. Most obviously, they've got a great collection of assets that they've accumulated very strategically and very intentionally. So they own a health insurer. They've got retail space, and they've been operating minute clinics for years and years. So they've got a lot of different irons in the fire, so to speak. They're also experimenting at CVS with what are called health hubs, which again won't be the delivery of care, but it's dedicated space within their retail stores for people with chronic conditions. And you may have access to a dietitian, for instance, in that space, or access to specialty medical equipment or products that will help you manage your condition. So there's a lot of excitement about that. The last player is the other 800-pound gorilla in the world of retailing, which is Amazon. And what we know about their approach is that they have begun offering healthcare to their employees, because they're a sizable employer. So in certain markets, your care provider is your employer. And they're leveraging their greatest asset, which is not real estate, it's digital and technology. So it's a very tech-centric approach to triaging your care as an employee, perhaps using a chat system to access virtual care, perhaps seeing a nurse practitioner before you're eventually escalated to a full-on MD. Where that will take us, we don't know. But there is a playbook for Amazon, which we all know, where they develop these internal services and then eventually make them public. So that's widely speculated is the path that Amazon will find itself on. When, where, how, it's all TBD.
So what you're proposing is this interesting network of different business models that people will have to be aware of when shaping their own and hopefully like we use the word competition, but there's also the learning experience from, if this works for this set of consumers, maybe there are some practices and learnings and things like that we adopt. One direction, and Kenneth Mwangi brought it up with regards to telehealth scaling being an avenue to scale coverage. And we got another great question coming in, very related from Shantae as well. As far as that virtual care or the digital front door, do you see Walmart playing in that space too, or how do you feel like that might impact the competitive picture?
I think a virtual care offering makes a lot of sense for Walmart as an adjacent offering to these clinics that they're building. Because despite the footprint that they have, there's still going to be parts of the population that still lack access to affordable care. And we know virtual care can deliver that. In addition, they've got primary care physicians now in these clinics. If there is a utilization challenge, why would you not have them delivering care virtually? So I think it makes a lot of sense to speculate as to an eventual virtual offering, either developed in-house or perhaps in partnership with Amwell, Teladoc, or some of the other giants that are out there. Have we heard anything definitive? No, but it makes too much sense not to imagine that they haven't thought of it.
And Audrey, I wanted to like throw that question at you similarly too. Just get your perspectives on this universe of tech giants, retail giants, and these different avenues that they can deliver care, including digital. What are your perspectives on maybe, especially having deep client relationships? What should people be thinking about in that regard?
Well, I think, given current climate, we've just seen tremendous adoption of virtual visits. And pre-COVID, hospitals and health systems have been trying to push virtual visits for years. This has been something that's been on their radar. And I think that moving into COVID, what was something that, I think people knew about it. Perhaps they knew it was an option, but now they're anticipating it, expecting it. It's becoming more normal. And I think it will feel normal for these consumers to dive into that play. And I also think it's going to be really interesting to see who makes it easiest for the consumer to, for example, schedule a same-day appointment. Is that flow easy? I think that how they embrace digital engagement tools that meet the consumer where they're at, make it easy, make it convenient, is going to be really telling of who's successful.
I love that thought. Walmart talks about a three-legged value proposition. Great care, obviously, nothing happens without great care delivered by physicians and other health professionals. They talk about accessibility with ultra low pricing, but Walmart levels of convenience, to your point, Audrey, is the third leg of the stool. And you think about the experience in traditional primary care. Some organizations are doing it very well, of course, but in a lot of organizations, it's not a great experience. The hours that you can access the physician are limited. Availability of appointments is limited. Parking's a challenge, on and on and on and on. And to a busy working family where mom's trying to get a checkup for son or daughter, those are all meaningful barriers that Walmart is trying to push down. So extended hours, walk-in appointments, free parking, unlimited parking, drive you name it. They've checked a lot of boxes that make the experience a really great one.
I'm curious, James, one thing I've been thinking about is the consumer experience with respect to expectations. My expectation when I walk into my primary care office, there's a lovely woman who sits there and greets me. There's plants. Yep. And if I'm going to a Walmart, I might anticipate to engage with a kiosk. And frankly, I'm okay with that. I'm walking into a Walmart. Do you think that people will shift their expectations about the customer experience?
So I should paint a picture of the clinics, because maybe I haven't done them justice. And there is a video that I posted on LinkedIn, supplied by Walmart, so it's got a little bit of sizzle to it. But it'll show you these clinics and I think give you comfort that they're actually very modern, very well equipped. very well appointed, and certainly not harsh fluorescent lighting, linoleum floors, wooden seats. It's quite comfortable and part of that overall experience of delivering great care. And I would just add, from the moment you walk into the clinic, they actually have a greeter welcoming you and steering you, on the right path to getting as efficiently as possible what you're looking to have done, whether it's an appointment or just a walk-in visit. They're going to make sure that you're not confused or wondering what to do. So customer experience has been really thoroughly thought through, and I give them kudos for challenging a lot of assumptions around how care should be delivered and upending a lot of conventional thinking.
Kudos. Yeah, I agree, mirror that thought, and I'll probably share a little bit more on that in a few minutes, just with regards to if they're out there in the market, they're showing that it can be done, and the experience that's generating, then that again bubbles all the consumer experience issues that a lot of people watching this have been focused on for years, and says, hey, here's here's why this should now be a priority for us. One thing, I wanted to make sure that our title of this event was not clickbait. Will Walmart take over healthcare? This is a question that I am going to address to both of you, starting with James. Everybody came here to see this. They came here to answer this question. Is Walmart going to take over?
So I'm going to disappoint people perhaps, but no, Walmart is not going to take over healthcare. I don't think Amazon's going to take over healthcare. I don't think CVS is going to take over healthcare. Healthcare is too big, too complex, and people have such diverse needs that no one can, quote unquote, take it over. That being said, they will drive disruption, both Walmart and others. It's inevitable that there will be winners that emerge from this disruption in retail health, but more generally, the disruption of primary care. So absolutely, there will be winners that fare very well going forward. And there will also be laggards and losers who don't change, don't adapt, don't revisit their customer experience, don't revisit their value proposition, and don't keep up with what people now expect as state-of-the-art in the delivery of care.
And Audrey, your thoughts?
Will Walmart take over? I don't think so. I do think they will be a force. I think they'll be a force. They have been in healthcare for a while, disrupting for example, their $4 prescription drug plan has been really interesting in driving down specific generic drug costs. And I think that they will be successful insofar as they partner with existing health systems to help complement and round out the healthcare experience. And I think it'll be really interesting to see who are going to be those health systems that step up and say, we don't see this as a threat. We see this as a opportunity to augment what we're delivering and to get a better reach.
Well, I really like that, Audrey. And I think we should all reflect on the public health system is pretty broken right now. There's north of 100 million people that have this lack of access problem, tracing to uninsured or underinsured status. That's a crisis for our country. And we should all cheer a solution that may be emerging that cracks the code on access to high quality care that's actually affordable to Americans so they can get preventative treatments and keep themselves well long before they need catastrophic interventions. So there is like a rainbow perhaps with a pot of gold for our country if we see these models actually delivering on their potential.
So appreciate that. Appreciate the responses because like very thoughtful. My response is going to be similar, but because we're in a call, 2 out of 3 people said no. So I'm going to have to say yes, and I have to figure out a reason why. So, yes, they will take over healthcare, but it's not just Walmart. It's companies that have different business models, different backgrounds, different ways of thinking, and therefore different ways of trying to drive and maintain and retain relationships. So what can potentially happen here from that, from like seeing all these new and innovative approaches, seeing all these different kinds of ways to address the consumer experience, is that I say that to the degree that you are in a room focusing and strategizing and improving based on what you're learning from some other entity. Well, something that they have done has come into your strategy, and no, it's not that they've taken all the patient relationships. No, they're not putting you out of business and like absorbing you. But in the degree that they've enacted change, they've helped prioritize the consumer experience. There's just an opportunity for the better, and there's an opportunity for people to finally see what happens when really advanced consumer experiences come to play, and it gives healthcare more opportunity and room to innovate. And I think that more than half of the people, probably 100% of the people on this call, are the types that want to lead that change and innovate within healthcare, and have been looking for that excuse to drive some of these more innovative initiatives. So I'm excited by. No, I mean, of course, there's market share, there's potential, and everything like that, but I'm just excited by the overall opportunity to grow, learn, and innovate from it.
Well said. Yeah. So let me. I think we're concluding. But if there are health systems in the audience, or physician groups, or dental groups, thinking about Walmart, perhaps you're in Florida and you've got the reality of them coming to your market in the near future. Shamelessly, I am a consultant and have thoughts, as you've heard and seen, that will help you navigate that uncertainty and get you on a path to collaboration, which is always the smartest path when you're confronting a giant like Walmart or others. So I'd be happy to hear from you and start a dialogue.
Start a dialogue. Anybody that you've met that like they've made these comments that you agree with, and you're like, wow, that question was on fire. Keep that network going. Make friends with James and Audrey. This isn't going to be the last that you see of James with us as well. We have some future presentations planned where one of us will actually go to a Walmart Health Center and report back on the experience. I mean, there's some exciting conversations in the works regarding this kind of disruptors mentality. So with that, just any final thoughts, Audrey, James, and anything that you hope that people can take away from this conversation?
Well, I hope I've painted a picture, not of anxiety. No one should be losing sleep today or tomorrow about Walmart Health. But they are a looming force that we should all be tracking and watching. And to the extent they are entering markets near you, yes, your level of attention should be increasing dramatically. But they are a force, and that's the picture I want to leave people with. We need only look at the Walmart playbook in grocery to see a potential path here, right? They didn't always have the grocery business that they have now. It was in 1988 that they opened their first supercenter, and there were doubters and detractors. You know, grocery's too complex. Walmart will never be able to deliver nectarines in January in Nebraska. The logistics will cripple them. They heard that all. And within 10 years, they were a top 10 grocery retailer. Within 13, they were number 1. And Sam's Club, of course, is number 9. So you can do the math as to the scaling and the success they've enjoyed in what some say is an equally complex and challenging business. So watch them carefully, people. Please.
Thank you. And also, Audrey, your thoughts, that what would you want people to leave the conversation with today too?
I'm coming back to this analogy I've heard from Clayton Christensen, who is kind of the father of disruption. And one of the analogies he challenged us to think about was, how do you take care of your vehicle? I know if there's a problem with my engine, I don't know much about cars, I'm taking it to the dealership. I'm going to take it, march right back in that door, see if the sales guy who sold it to me is available. Be really, really thoughtful about that decision. And if I have a flat tire, if I need an oil change, I'm going to go to whatever is physically closest to me. I may not have tremendous brand loyalty there, but whoever does a great job. So I think in the same way we can think about healthcare. If I have cancer, I'm going to be really particular about where I go. But if I just need a test or a checkup, or I've got twin toddlers, and if there's someone who can get us in for dual kid appointments same day, that's a great convenience for me. So I think there's a lot of ways we can think about how these retailers can round out the healthcare experience.
So, great final thoughts. I mean, this gives a lot to, hey, what is Walmart doing in the universe, and how can we start using that to drive the experiences that we're creating for our own consumers? This isn't the last of these conversations. We recently had one later last year with regard to One Medical. Future conversations around these disruptor approaches as well. If you want to keep informed on that and know when those conversations are happening, if you go to our website, symphonyrm.com, and scroll down to the bottom, you can sign up for our newsletter. And on a monthly basis, we put out content that we announce these types of webinars. We make those recordings and things like that available. So it's a continuing education opportunity, as well as if you subscribe to us on LinkedIn, then you should be getting notifications about it. But really excited to have those conversations. Really thankful, Audrey, coming on here and co-hosting, James coming in and sharing this deep knowledge. And with that, we hope that this has been a good experience for you as well. Let us know how you feel about that. Let us know your thoughts, and let us know whatever, like if there are topics that you'd like for us to cover in the future, or questions that you still have, drop them in the comments or send them on over. We're happy to hear them.
Thanks, Chris. Thanks, Audrey. Thanks, everyone.